This topic is discharge planning. Discharge planning is important for clients to receive the best possible care while in the hospital and then planning for continued care when they are discharged, whether that be to a different floor or unit, facility, or back home. Discharge planning begins from the moment the client comes into the hospital, and you'll hear me say that a lot. We as nurses work with other professionals and other departments throughout the hospital to make sure the client is receiving the most comprehensive and best care we can provide. This includes interprofessional collaboration. That's when two or more people from different professional fields come together to achieve common goals for a client. Nurses play a crucial role in collaboration amongst providers and specialists because we oftentimes are the ones who initiate collaboration, and we also have a lot of information necessary for the collaboration. Many times we have a better understanding of the client's home situation because we spend the most time with the clients. This is all essential in safely caring for clients with complex conditions. Different professionals have different specialized knowledge. It requires open, effective communication and requires a mutual respect, respecting each other's expertise. This can also help decrease readmission for clients because we are working together with each other, the client, and the client's family to better prepare them to care for themselves. We want them to continue the care they were receiving in the hospital and translate that to caring for themselves away from the hospital. Collaboration and referrals. Collaboration involves care planning and care continuity through the use of referrals, and we'll talk more about that in a minute, and consultations. Consultations seek the expertise of a specialist. It's asking a question or advice or an opinion about a specific problem. It could be asking a dietitian, pharmacist, social worker, or even a more experienced nurse. A client care conference is also used for collaboration. It involves all members of the healthcare team, and we want to encourage client and family participation. If we can involve everyone in the plan, we are more likely to achieve the goals together. When we collaborate, we will provide information to other healthcare disciplines. We want to have that information ready, available, and organized before you make that phone call or before you go into that care conference. Prepare yourself with knowledge and information. You may want to organize it using an SBAR format. You will want to include pertinent background information. That includes social and cultural context, if it's important. And has something worked for the client before or not worked? Also, do they have the support for what is being planned for them? We'll include objective and subjective data. We're going to report facts, the objective data, and then interpretations, the subjective data. We want to clearly report what is going on, like changes in client status, what is going well and what is not improving. And then treatment and procedures. What has the client had done and what is still going to be done, and maybe what you suggest should be done. An example might be, yesterday they had a chest x-ray and today they are going to have an MRI. We'll also include medication records. What is important for the other professionals to know? Reports should be factual, organized, and current. Referrals are including other providers in the management of care for a client. It's transferring of care or inclusion into care, and we expect that they will take some responsibility. They will follow through or follow up with the client, whereas a consultation, we're just asking a question or opinion. A referral helps connect clients and their caregivers with resources they may not have known about or had access to. We can refer clients who need assistance with existing or potential conditions, like speech, occupational, or physical therapies, a lactation consultant, or specialists, like an ear, nose, throat doctor, ENT, cardiology, or an orthopedic surgeon, or with a dietitian, home health care, or social worker. We will include pertinent documents for the referral to provide useful information, the medical record, and a referral form. Referrals are a great way to identify community resources like social services, shelters, and support groups. Discharge planning can mean many different things for a client. Discharge can be going home, or it can be moving between levels of care within the hospital, or from the hospital to long-term care, or from a rehabilitation center to home. Again, discharge planning begins the moment the client enters the hospital. We are considering what has been done for the client in the hospital and then how that can be done when they go home. And we, of course, want to include the client and their caregivers in this planning. In some facilities, this is the nurse's responsibility. There are a lot of teams and specialists we can include in the client's discharge planning. Social workers, they know a lot of resources and programs in the community to help with financial support for housing, food, clothing, or needed medications and supplies. Think of the client with diabetes and the supplies required for management. Housing, maybe financial support for housing or changing housing for the client who is now in a wheelchair and lives in a building with no elevator. Or assisting when people don't have a safe place to go home to. And they can help with interpersonal relationship difficulties. A dentist, to help with issues with the mouth or teeth. And there are different programs in communities for clients who cannot afford a visit to the dentist. Dietitian, to help with weight loss. We know obesity places a client at risk for many disease processes and complications. They can also help with special diets. Maybe a client now has to follow a heart-healthy diet, low-salt diet, or gluten-free diet. And meal preparation, teaching a client to better take care of themselves with proper meal preparation. Occupational therapy, to help with those activities of daily living, those ADLs, and fine motor skills. They can also help finding and providing adaptive equipment, like kitchen utensils that are modified for someone who cannot grasp a fork due to a stroke. Physical therapy, working with musculoskeletal issues and movement and mobility, assessing and then planning interventions. And rehabilitation, using exercises, heat, massage to improve strength and mobility. And spiritual support, pastors, rabbis, or spiritual advisors. This may also provide an additional community the client can reach out to for help, like with transportation to appointments, or food, or even help around the house. And alternative therapies. These are often used for pain relief and then maintenance. A chiropractor, working with alignment problems of the spine. Acupuncture, that's stimulation via needles inserted at specific points, meridians of the body. Reflexologists, it's a type of acupressure, pressure applied to specific areas that are reflex points connected throughout the body. Now let's think of some of our clients and how we can put this into action. Here are some examples of how we will take care of clients in the hospital and how we are always thinking of how to transition that care to them going home. That whole idea of discharge planning begins the moment the client comes into the hospital. As a nurse, you are thinking about this as you are caring for the client. How can what we are providing for the client be continued when they leave our care? We also want to keep in mind, are the plans that are made for the client accessible to the client? Are there appointments made that they don't have transportation for? Are they prescribed medications that they cannot afford? We have to be aware of what is affordable and available for the client and what they are able to accomplish. To do that, we always want to include the client and the caregivers so that everyone knows the plan and then the plan can be successful. So now let's think of some specific clients and how we can help them. A client who has to use a walker will consult physical therapy to work on strength, mobility, and balance, and maybe a social worker to look at their housing or obtaining a walker. A client who requires infusion therapy. They'll probably have appointments for infusions, so maybe the social worker will have to help them with a plan for transportation. A client who has a non-healing wound will probably want to make sure they either have a home health care nurse to come into their home, or if they have to go to appointments, maybe a social worker to help plan transportation and to financially help them with supplies. A client who had a stroke, that will include occupational therapy for adaptive utensils maybe, or physical therapy for balance or weakness issues, and speech therapy for swallowing issues and learning how to safely eat again and to work on speaking if that's an issue, and a social worker maybe for rides for therapies and appointments. A client who is newly diagnosed with diabetes mellitus. That will include a diabetic educator to teach and reinforce blood sugar testing and insulin dosing and administration. And diet. That may include a dietitian referral. And a social worker to maybe help them financially to pay for supplies and medication. How about a client who has a new prescription for anticoagulant medication? That'll probably involve laboratory appointments for checking those laboratory blood levels, and maybe a pharmacist referral to help explain this new medication and what to expect, and maybe a social worker to help plan transportation. A client with a new cancer diagnosis. That will involve a care coordinator or nurse navigator for the numerous appointments, procedures, and specialists they may need to see. A psychotherapist to work through feelings and emotions, and maybe a social worker to help with transportation to medical and therapy appointments and to suggest community support for the client. This was just a little example of all the things we take into consideration for a client in our care and their discharge planning. We want to help our clients receive the comprehensive and continuing care they need.